my credentials. Oh, cool. Awesome. I love when it yells at me like that. Okay, I get it. You're recording. Yeah, so like Dr. Martin said, my name is Alison Patev, Dr. Alison Patev. I actually just finished and graduated in December from the health psychology program here at VCU. So to keep hearing doctor before my name is still kind of a shock. So I get a little smile out of me every time someone says it. So yes, please keep addressing me. I don't know when it will ever get old, if it ever gets old. Yeah, so I'm excited to give this presentation. So I actually teach the research methods class in the psychology department. So that's a much longer process. I get a whole 4 to 12 weeks, depending on when I'm teaching it, to actually teach students how to write a paper. And that's one of the biggest projects on the class. So I've tried to kind of consolidate a lot of the biggest lessons that I want to instill in my students from that class into this presentation. And I've also given it to undergraduates and trainees in my own lab as well. I'm going to try to tweak it here for a more School of Medicine based audience. So again, this is going to be for people who are really just starting out their careers, really starting out writing manuscripts. So for those of you who have a bit more scientific or academic manuscript writing, a lot of this is going to look really familiar. You're probably going to be like, okay, I know all this. It's not necessarily for folks who have a ton of experience. But if you're just starting out and want to learn more about the general structure and getting some tips, this may be for you. So just bearing that in mind as we go through. So I should actually click start the slideshow from the beginning. All right, so just to start off, what is a scientific manuscript or an academic manuscript? What am I talking about here? So when we're talking about a manuscript, this is some kind of writing where you're sharing research related, clinical related, or some kind of empirically supported findings. So you can share your own empirical research where you have conducted a research study or studies. You've put all of your findings into one place, and now you're going to publish it in a peer-reviewed journal. You could be focusing on doing some kind of literature review or a synthesis of the literature. Sometimes we call these systematic reviews or meta-analyses, depending on your method and what fields you're in, where you kind of take all of the research, summarize it, and maybe give recommendations or write about implications based on all of that research. Methods papers where you're writing about a specific method. Teaching briefs, that's something that I'm interested in, where you talk about best practices for teaching. We can maybe get some teaching briefs out of our intervention, maybe. And of course, there are documents that will tell you about like clinical best practices and guidelines that often pop up in journals as well. But for the purposes of this talk, I'm mostly going to be focusing on the empirical research. So you've done a study or the lab has done a study and you're starting to write a manuscript on it. Some of the lessons will apply to other places, but there's more nuance there. We're just going to keep it simple with empirical research. And these are generally things that you are going to be sharing with people who have similar-ish training to you. So this is generally other academics, other healthcare professionals, or people generally in a college university environment, maybe in other organizations as well. But oftentimes this is generally not something that is shared with the public. It can be translated and shared with the public. And that's, I won't go on to that rant because that's one of my biggest problems with academic writing is it's not very accessible. But when you're writing a manuscript, it is generally going to be read by people who have similar training to you. All right, so we know the sections of an academic manuscript, and I'm going to be talking about these in depth a little bit, providing you with a general outline for each section as to what kind of information should go into it. You're going to have an introduction to your paper. You're going to discuss your method or your methods. In psychology, we're really hard up on calling it a method section, and some journals are too, but there are a lot of journals in a lot of areas where you would report the methods. Single S, and people get really, really, really upset about it. So I will just list both here, your results section and your discussion section. So let's jump in. We'll talk about the introduction section, right? So the introduction section is you're introducing your topic, but it's not just about introducing your topic and sharing your research questions, their hypotheses, the purpose of your study with your readers. This is a place where, in as few pages as you can, persuade your reader that this topic is important. Why is your topic something that needs to be studied? Why is this study important? Why are your findings important? You want to tell your reader that in your introduction. Let them know why this topic is so necessary to be studied. And generally for medical journals, I love this about medical journals, this section is very brief. So you might be writing and the section is like a page, 2 page, maybe a little longer. If it's a more complicated topic, maybe a little shorter. When I've published in a lot of psychology journals, for me, this is like 8 pages, 9 pages. They want to know like the whole history of everything ever in great detail. But for medical journals, generally this section is fairly brief. So you don't have very much time in which to persuade the reader that this topic is important. So here's a basic outline, and then on the next slide, I'll tell you a little bit more about like how to kind of make more of a compelling case and how to persuade your reader that this topic is important. But here's kind of a basic outline. So I tend to section it into 3 different parts. So you have your either introduction paragraph or introductory sentences, probably sentences if you're in a medical journal and your writing is brief. This is where you're going to introduce the topic, tell your reader what they're reading about, providing a little bit of context for that research. And this usually takes the form of describing some kind of problem, whether that is the rates of a specific disease, the prevalence of a specific problem, providing evidence that this is a problem that is affecting a lot of people and something that research needs to examine, explore, and why you need to be writing this paper. Then you're going to want to synthesize the existing literature. So this isn't just listing studies. I just reviewed a paper actually on an HIV stigma intervention where the whole introduction was basically just a list of studies, and it was very hard to read because it was very samey. It was very, it was just very hard to read. So this isn't just necessarily like listing like Smith, Patev, and Smith 2020 found X. Smith and Patev found Y. It's not where you're listing places. You want to synthesize the literature, especially again, when you have such a short time to introduce your topic and make a case for why it's important. You want to make sure that you have a really good summary of all of the literature on a specific area. And sometimes you might need a theory or model to justify your hypotheses as well. So that would go in here. And then in the last section of this, you're going to reiterate what the purpose of your study is, tell them what the purpose is. You might have hypotheses or research questions. You want to include those there and then kind of just wrap things up. And again, kind of hammer home, why is this so important? So a few things you can do to write a compelling introduction. So these are all citations from the current issue of the Green Journal. So what I like to do, I like to include statistics about a population whenever possible. So in the United States, pregnant and birthing persons die at a higher rate than in other high-income countries, and this rate has increased from an estimated 27% from 2000 to 2014. So this is illustrating for readers that death in the perinatal period among pregnant and birthing people is a really big issue. This is something that really deserves to be explored. So you can use some statistics like this in order to make a case as to why this topic is so important. You can also give background on the problem. So particularly if you are conducting research on an issue that is really influenced by the current time period, a current world situation like the COVID-19 pandemic, you might want to give a little bit of background on what has been going on in the pandemic. So that's what this next citation has done as well. And then of course, you're going to move into offering evidence from previous literature to kind of complement that and summarize what previous research has said about this topic. So these are kind of a few different suggestions that go along with that little outline. So my first writing tip, something that I have found to be really helpful, and maybe for some of you this is kind of like a duh point, but I feel like I did not realize this for quite a while after I had been writing papers. I hated writing both the introduction and the discussion because they tend to be, at least for me, the longer sections of the paper, and I would always have to do literature review for both sections, and I would hate it. And I've noticed that a lot of folks in my own lab, grad students who are just starting out or undergrads when they're trying to write this project, they do all of this literature review for their introduction. And then they get to their discussion and they're like, we have to do all of the lit review like ever. And they forget that they kind of already done it. So one thing I want people to keep in mind is use the introduction to drive your discussion and vice versa, depending on what you write first. Yeah, so when in your discussion, you are always going to be linking your findings back to previous research. So you're going to say that our findings are concurrent with previous research, they don't agree with previous research, they are related to previous research in some way. So use the information from your introduction, use those citations to drive parts of your discussion. You don't need to do a whole new lit review. You don't need to find whole new citations for a lot of stuff. Use what you've said already in your introduction to tie it back together. It kind of brings your paper full circle and makes it seem a lot more coherent and cohesive than if you weren't talking about any of the information in the discussion that you talked about in the introduction. So now I've included an example here. So just something to keep in mind. It's very samey. All right, so moving on to the method or methods section. So this is the section where you're going to describe the method. How is your research conducted? And this is important. It's allowing people to assess your research in a lot of cases, to see how valid it is, how reliable it is, and in some circumstances, allowing that people to either replicate it or extend upon it in some way. We're really big with replication in psychology, particularly social psychology, the whole replication crisis. People just really like to repeat findings and see if you get the same thing. It adds to kind of the credibility of your research and the validity of your findings. So this is a space where you're probably going to want to describe in as much detail as possible. You don't need to give every last detail, but probably giving as much detail as possible just allows people to assess the validity of your findings better. And it may also have some kind of impact on your results. So you choosing one method over another may have some bearing on interpretation of your results. So there's three main sections. Some people split it up into more, some people split it up into less. When it comes down to like section headings and how people divide up their papers, it's very individual. It can be a personal preference, it can be up to the journal, but these are kind of the three sections you'll almost always see, especially for me in psychology and in a lot of the medical journals I've read as well. So you're going to want a section where you talk about your sample, your participants. Who did you conduct the study on? Was it patients from a specific clinic? Was it medical students? Was it healthcare professionals in a specific healthcare system? Who was it? And you're going to want to tell a bit about these participants, usually their age, gender, race, age. I don't know why that's there twice, but apparently it was important enough to put twice. You're going to want to talk about who these people are because demographic characteristics can have an impact on your results. You're also going to want to include any relevant characteristics for the study. So if you are examining patients from the Motivate clinic, you might want to talk about any diagnoses they might have, different aspects of their pregnancy, how far along they are, is this their first pregnancy, is this their 7th pregnancy, how many live births they have, things like that. That might be important to report in a sample section. You're also going to want to report what materials or measures that you've used in this. So if we are looking at substance use disorder related stigma, I might be reporting a substance use disorder stigma scale or a stigma questionnaire that participants have reported. If you are doing more biologic-based tests, if you're running fMRIs, if you're doing urine testing or blood testing, you're going to want to report as much information about that as well as you can. And again, to go back to the rigor of your study, this is going to help people know that you did it right or did it well. I guess there's no right way really for a lot of stuff, but it's going to tell people that you did it well, and they are going to find less to pick apart in your study. You got to get everything past reviewer too. And then of course you describe what people went through, what your participants went through. So they sat down at a computer and in half an hour they completed a series of measures. People came into the office, completed a couple of measures, gave a urine sample, and then left. You want to tell as much as you can about the procedure, what exactly they went through. And again, for replication's sake or the assessment of the validity of your study, this is really important. And there's some other things that journals usually ask for. So you're usually going to want to say like, oh, this study was approved by the IRB, participants consented, the study took about half an hour. Journals like to add stuff like that. I don't know to what extent a lot of medical journals do that, but psychology journals, they want to know like every last detail about your study, how they were compensated, all of that. All right, so now shifting gears, moving on to the results. This is usually the whole point of the paper, is to share your findings, to share the statistics that you've run and what those statistics showed. So just as a note, I see this a lot with people who are just starting with academic writing. They will share their finding and then they will try to explain it immediately. So we found that patients who were given drug X had better outcomes than drug Y, and we think this is because of XYZ pathway. This is not the space to discuss why. That's something that's going to be held in the discussion. That's the space for discussing why. This is just discussing what exactly you found and listing numbers, basically. That's what I tell my students. This is the place where all the numbers are. So you're going to want to report at minimum what statistical analyses you did, and then the results of those analyses. So whatever you have run, we conducted a independent samples t-test, and then you're going to want to report the test values. So if you ran a t-test, you're reporting the t-values. For that, you're probably going to want to report standard error or confidence intervals, definitely p-value. Everyone knows p less than 0.05 is one of the values that you want to shoot for, and any post hoc values. So if you've run an ANOVA and then want to find differences between pairs of groups, doing post hoc testing, so testing after the testing, if applicable. And you're also going to want to explain what the statistical values mean. So you would list all of the numbers that you have to list and then say, well, this indicates or this shows that patients who exercised regularly had less pregnancy-related complications than those who did not. So you're giving like a bare bones interpretation of results, but you're not moving into why that might be. And then this is a place where you will at the very least reference your tables and figures. Sometimes you stick them in the text, sometimes you stick them at the end. That's really up to the journal. But you would at least talk about, we ran post hoc testing and that's in table 2. You'd stick that here as well. I feel like this is like, people talked about this in like Bio 101. I feel like I remember this, but just when you're writing, just remove the word prove from your vocabulary. Just remove it. You can't prove anything. Instead, your findings have provided evidence for it. They demonstrate that, they've suggested that. This is something that I see a lot in undergrads when they're writing. They think that using the word proved is really scientific and that their correlation has proved something. And I have to tell them not to use the word proved. So just avoid that in your writing. Again, I feel like that's something that most of us know, but I feel like I just needed to say it. All right, so last section is going to be your discussion. So this is my favorite section to write for some reason. People are like, why? It's because you can just kind of come up with, for me, coming up with implications for future research and clinical application or policy. I can kind of come up with whatever I want. What I think is important, what I think are the main takeaways of the study. And it doesn't take a whole lot of lit review, which is unfortunately my least favorite part of the writing process. So I love writing discussions. So there's a lot of different pieces that go into writing a discussion. So the first thing you're going to want to do is summarize your findings, provide a more in-depth interpretation, or re-summarize the interpretation depending on how many analyses there were. And this is where you're providing explanations for your results. So we found that exercising regularly led to less complications than not exercising regularly. We think this is because, so on. So this is where you would provide an explanation for your results. And this is also where you're going to, like I was saying with my little writing tip 1, you're going to connect everything in your discussion back to your introduction, back to different citations in the introduction. So this is where you would say, our findings are concurrent with, or our findings are similar to those of Smith and Patev. And then you've already cited Smith and Patev above, so you don't have to go digging through the literature again for that. You're also going to want to suggest directions for future research, as well as practical applications. So based on your findings, where might future research go with this, as well as suggestions for how this could be applied in clinical practice, and sometimes even policy making as well, which a lot of my work dealing with stigma does have application for policy, or training or things like that. So that's the kind of fun part, to be able to kind of think ahead and think about, well, how could this research actually be applied? I will caution you with the coming up with different directions for previous research. I got a comment from a reviewer once who told me not to pitch my entire research agenda in my paper, which is pretty much what I did. I had like 8 different things listed, and he was like, you don't need to give me your research program, just list a few things. So pick and choose. You don't have to put like everything you can think of, just pick and choose the things that you think are most relevant, most applicable. And of course, it's very important to be able to discuss limitations with your study. No study is perfect. Nothing. You can control for all of the things. You can make sure you're using the best research techniques, but no research study is going to be perfect. There are always going to be limitations, so that's going to be listed here. So generally, we would break these up into three sections. Again, how people organize this and put headers on this is kind of personal, or it's up to the journal, depending. But how I usually organize my discussions, I would start by summarizing what I found, interpreting it. What do these findings mean? Why do we think they've happened? And then connecting that to previous literature. I move into limitations. I like to stick my limitations kind of in the middle. I have like a sandwich method where it's like good stuff, the cool things we found, limitations, the sucky stuff about my study, and then implications, which is the cool stuff again. So I kind of varied in there. But I've seen a lot of people who really like to put their limitations at the end of their paper. So again, it's kind of personal choice. Yeah, I stick that right in the middle. And try to list as few limitations as possible, because I'm that person that's like, oh, we could have done X, Y, Z, A, B, C. Oh, and then I have 25 limitations, and Dr. Hood is like, you can't list all of those, Allison. They're not going to publish that. You can't list all of those. So again, be sparing with your limitations. You might be able to think of 25, but list the ones that you think are most relevant. Yeah, so it's important to be honest, but don't be like too honest. I tend to be too honest. And then finally, I would do any kind of implications, clinical implications, policymaking implications, or implications for future research. So another thing to consider when you're starting writing is consider what order you want to complete sections in. This is something that I feel like it's really easy, and I unfortunately teach this in my research methods class. The paper is introduction, method, results, discussion. So people will go through and write introduction, method, results, discussion. You don't have to do it that way. One of the ways that we learned, Dr. Hood went to a talk, who was my doctoral advisor, went to a talk, and she was taught that the best way to write a paper was like doing your tables and figures first, then doing your method, results, discussion, and the introduction last. So that was something that we tried in our lab for a while. Some people like to write the introduction first and then the discussion. Yeah, it's really up to you and your personal style. I prefer to do method and results first, and then I put off doing tables and figures as long as humanly possible, because I just don't like doing that for some reason. It's really tedious for me. So I just push that off as long as possible. But thinking about who's writing what section and thinking about the order that you want things to get done in so it gets done efficiently is something that you need to consider as you start writing. And there's nothing that says that you have to stick with the same thing for every paper that you write. Play around with it, see what works best for you, especially if you foresee a long future of writing for you. I would also like to press people to talk about authorship. Talk about authorship, talk about authorship, talk about authorship. Talk about it early on in the process and often throughout. So it's going to depend on a lot of different factors. So study design, study conduct, who has done the bulk of the writing, as well as your lab and collaborator culture. I know that occasionally there will be a lab culture where senior members or specific members of the lab are just slapped on every single paper, even if they didn't look at it. And that's the lab culture. Or there are some places where people have people in positions of seniority will be put onto the paper in a higher position. So that's actually happened to me. One of the first papers I worked on, I did a bulk of the writing, and I probably should have been third author, but we had a senior member on our grant who did not do anything, but was put in the third author slot instead. And I was a master's student at the time and didn't really have the power or care to fight back about it, but it does happen. So this is why authorship, talk about it early on. It's not always a comfortable conversation, depending on who you're working on papers with, but it's a necessary conversation that needs to happen. So make sure that you're establishing authorship order or some idea of authorship early on in the process. All right, so I'm getting to the end. I have a number of lessons that I have learned that I would like to impress upon people. And the first is, don't worry too much about sounding smart. A lot of folks will go into writing academic papers and they think that they have to use like $1 million words. They think they have to use SAT or GRE words, and they try to like sound smart, or they try to use a lot of jargon. You don't necessarily need to do that. If there's important words that are related to your study, use them. But I mean, your paper shouldn't read like a thesaurus. It needs to be readable by people from many different areas and many different reading levels. So the clearer you can be with your writing, the better. It's always better to sound clear and readable than it is to sound smart, whatever that means. So don't worry too much about that. Easier said than done, I know. But once you kind of let go of that and focus on clarity of your writing, then writing gets a lot easier. And also, this is something that Dr. Hood and I talk about a lot, telling the story of your research. So again, when you're writing about something, it's academic, it's not prose, but you're still kind of telling a story about something. You're providing the background of a problem. You're talking about what you're doing. So I don't know, are you the main character, or is your research the main character? But like, if you think about your research as the main character, you're kind of telling a story of your research throughout. You're focusing on a background, focusing on what you've done, focusing on a high point, which is your results, and then kind of winding down from there and talking about the future. Think about it as telling a story, if that's helpful. That's something that Dr. Hood is always asking me when I'm writing is, what's your story? What is the story here? What are we trying to say to the reviewers? What are we trying to say to anyone reading this? What is your story? So if you want to think of it as a story, maybe that's helpful, maybe it's not. Feedback from other people is vital. So I'm sure pretty much everyone here has opened a document and has seen all the little comment bubbles on the side, and you've been like, oh, shit, my paper must suck. Not always. I have a tendency to overleave the comment bubbles, and actually little comments, if you're getting lots of those from me, it's a good thing. But generally when people are leaving comments, they're trying to make your paper stronger. You're very rarely writing a paper by yourself. There's always going to be some kind of collaboration there. And everyone working with you they want to publish this paper. They want to make this paper stronger. So don't fear the little comment bubbles. I know it's not a great feeling to see a lot of, like, you open it up and it's all red from the track changes. You get a lot of comments. That's not always a bad thing. That's making you a better writer, and that's making the paper better overall. So try not to fear the little comment bubbles too much. Again, easier said than done, but just something that I've learned. If I see a lot of comments from Dr. Hood or one of my collaborators, I'm like, okay, I have to reframe it in my head. Okay, they just want this paper to be better. They just want the paper to be better. It's not about me. They just want the paper to be better. So again, that's something that comes with practice, I think. Yeah, because there's no such thing as a perfect paper. Even if you and your collaborators write this paper and it's the best that you can absolutely make it, who's going to hate it? Reviewer 2. Reviewer 2 is always going to hate your paper. The reviewer 2 joke, or a reviewer. I know reviewer 2 is the reviewer that gets picked on. But your paper has to go through peer review usually, and there will always be reviewers or readers who are thinking, well, this isn't the study I would have done. This isn't the paper I would have written. This is not where I would have gone with it. There's always going to be people who are thinking that it's not perfect. So as long as you are doing the best that you can on it, that's good enough. There's never going to be a perfect paper. Always budget more time than you think you need for writing. And sometimes you'll be pleasantly surprised. But if you think it's going to take you an hour to write a section of a paper, at least double that, maybe. Just in my experience, especially when lit review is involved, or you haven't been writing for very long, or you're writing on one of your first manuscripts, you may not have a very good sense of how much time it's going to take you to get to the end point of what you need to write. And along with that, but people will say to budget out writing time as well, and write in smaller chunks. So maybe you budget out like an hour in the morning on one day to write, and then an hour in the afternoon on another day to write. And then you write in smaller chunks. That might be useful, but definitely planning and thinking about your time management while writing. Always give yourself more time than less time. And definitely be setting deadlines for yourself, even if it's not a paper that has a due date like in class. It's something that is going to be submitted when it's submitted. But definitely try to set deadlines for yourself. But for me, I don't stress too much if a deadline is blown. Life happens, especially right now, with COVID and everything, and things are in person and things are not in person, and people are getting sick, and then people are don't stress too much. It happens, but definitely try to keep yourself on track, because that'll definitely cause you a little bit less stress, and maybe some of your collaborators as well. And then finally, paying attention to the journal guidelines. So definitely having an idea of where you would like to submit your paper beforehand, and paying attention to journal guidelines, because sometimes they have weird formatting requirements, even if the reference style is AMA, they'll have weird, all of the subheadings need to be italicized and tabbed over 6 times, and they have very strange formatting, and you don't necessarily want an editor to be doing too much work or to reject you just because you didn't follow the guidelines. So paying attention to those, always useful. All right, I think I've talked enough. I'd be happy to take any questions about manuscript writing or anything.
Thank you, Allison. I feel like you said so many things, and I was like, yes, these so many little pearls of wisdom.
Yeah.
I I'm going to first, a suggestion that came up from some people was to kind of just highlight the authorship thing. Do you mind if Bhushan shares his screen for 2 seconds, and then
Oh,
I'll
yeah.
open it up for discussion after that? So authorship is always a great thing to talk about. I try to bring that up early in the conversation when I'm talking with everyone, especially trainees. So if you've had that conversation with me, if at any time with me or with any other PI, if you're ever starting a project, starting a paper, and you have not had an authorship conversation, you as a trainee are completely allowed to say, ask when, are we going to have a conversation about authorship before this project kind of really just gets going? It is completely appropriate for you as a trainee to say that. I know that kind of makes you a little like cringe on the inside, like I'm never going to say that to Dr. So-and-so, but sometimes we just forget. Like literally, because I was always trained, like you always talk about authorship very early on. That's what my mentors taught me to do. And so I try to do that, but I forget things sometimes. So that's number one, is that never, ever, ever be afraid to bring that up with your PI ahead of time when you're starting to write a paper. Number two is that we do go by guidelines for the lab. So what Bhushan has brought up is actually the research agreement that everyone should have signed. If you have not signed one, email Bhushan and he will get it for you. But the research agreement for the IV lab, there is a whole section around here that he's highlighted about authorship guidelines. So we do go by the International Committee of Medical Journal Editors authorship guideline. I'll put in the chat the link to it. It's very set in stone, who gets authorship, period. So it's very clear. And then order of authorship, what did I write here? Will be determined before initiating. Yes. Well, there you go. Whatever we wrote here is accurate. So we actually took time to write this specifically for the lab. When working with trainees, it's very common to determine the authorship order. But as a PI, when I'm working with trainees, what I do is I will say, but I can change the authorship order based on how the project continues to go along. Why do I do that and kind of like violate the rule of authorship before you start anything? Is because everyone's learning and people come and go, students graduate, people go on new projects. And if people have never written a paper before, people are going to need different levels of assistance and guidance through that paper writing process. And so we strictly go by the IGME guidelines for authorship, but the authorship order there should always be a preliminary list of authorship order before you start a project. So you should always speak up with your PI and your study team about that. But just know, as a PI who works with trainees, that can change. But like Alison said, the authorship order should be an ongoing conversation in any research group you're in. So if it's been 6 months, you're continuing to work on a paper and no one has talked about authorship yet again, and no one's brought up, you have complete right as a trainee to say, oh, can we just revisit the authorship conversation? I know we talked about at the beginning of the project, but a lot of things have changed since then. I just want to have that conversation again. And it is completely appropriate for you to do that, because a lot of times we'll just forget. And I will say too, if you're ever in a lab later on or working with a group where the PI does not want to have that conversation with you, or they demean your advocacy to have that conversation, or no one is willing to put it down in writing, or you should not work with that group, because that is sketchy. And you have rights as a trainee. I've been there before where, I was on a paper, just like Alison was saying, I've had my own experiences where I was, it was not a clear conversation ahead of time, but the work I was doing, I thought determined a certain authorship. It came around and that's not what I was being given. And I was very confused. And it would have been very nice if I, as a trainee, had brought that up ahead of time, because my PI at the time just didn't do that. And I think she would have brought it up and talked to me about it, because she was a good person, but I think she just didn't bring it up. So that's just tips for later on in life when you start to work with other people. And then you should definitely bring it up with me if I haven't brought it up with you, or we haven't had that conversation in a while.
Yeah, because authorship can change throughout the writing process. And I've seen it happen where somebody gets too much on their plate and they don't complete their section. So somebody else steps up and does it. And that changes the authorship order a lot of times. So it happens.
Mm-hmm.
So yeah, I don't know if there are any questions, comments.
I don't have a question. I was just going to say one additional comment about getting feedback from the people that you're working with, whether it's your advisor or other authors. One of the best pieces of information that I got to help me think about feedback in a kinder way is that you're writing for the reader, not for yourself. And so you really want it to be understandable to anyone who picks up your paper and reads it. And so I try to think about feedback as, instead of saying, oh, they just didn't read it right, they didn't, understand what I was saying, it's that I need to word it or frame it in a different way so that it's clear and understandable to anyone who picks it up. And that has helped me be more accepting of feedback. So I think that's helpful.
Yeah.
Really great talk, Alison.
Thanks. Yeah, I love that bit of advice. I think I will start using that to reframe some of the comments I get in my head. Yeah, it's not
it's helpful.
Apparently my dog has something to say. I don't know.
I'll just bring up one more thing too. If anyone who's worked with me on a project knows that I do have preferences on the order. So like Alison said, everyone has their own preferences. I have lots of preferences. And one of them is that I generally do start with tables and figures. So Samaya knows this very well. So when she was working on her project over the summer, Samaya worked on an outline for her paper where we set up the study design and we're very clear about that. And then we also made blank tables and figures. And then that's what I typically work from. So when you work with me, that is what I will tell you to do because that's my preference, but you can do whatever you want later on when you're at my stage. But when you're working on projects in the lab, that's typically what I prefer. So I think that it personally, again, it's super opinionated, but I think it helps you think through the data from the beginning to the end. So you think about how am I not only going to get my data into a place where Hannah can analyze it appropriately and it's not going to be all messed up. And then also how you're going to present it at the back end. And like Alison, one of her pearls was you need your data to tell a story. I mean, if you've worked with me, I say that all the time, like, oh, this tells a great story, right? Or, you just want to tell your story more. What story is your data telling you? I do say that a lot because our data is also quite interesting, right? Because we actually get data from patients. We have qualitative data and quantitative data that we get from real people that Margie and I know very well for the most part, right? A lot of them are our own patients. And so our data really can tell a story. And so I would say that I think that making your tables and figures first helps you really think through how your data is going to tell that story and how you're going to present that story with your data. You're not writing a paper just to write a paper. If you're writing a paper by using your data to tell a story in a certain way, by actually having data to back up what you're saying in your discussion. So
I'll just bring up one point as just going back to what Annabeth and Alison were pointing out was feedback or just red bubbles or red comments aren't always they didn't like what you wrote. Sometimes it's just seeking clarifications because somebody's reading your draft for the first time. And something that I would recommend is responding to comments directly on those documents are also helpful because sometimes it's just the person didn't understand what you're saying. So responding to comments or making track changes at that point is also something to communicate when you're going over these points on email. So don't worry about all the red marks. They are just assigned to show how much the person who's helping you on or giving you feedback cares about you and wants to get better on the writing. So always take that as a positive and you get better the next time. So yeah, but great talk, Alison. I took a screenshot of that last slide and I'm sure I'll keep that in mind. And if somebody giving it to other trainees is these things and to kind of point out everything that goes on. So thank you.
Yeah, if there are no other questions, thanks y'all. I actually have to run. I'm taking a writing class, not an academic writing class, that's meeting in person. So I actually have to run. It starts in a bit. So thank y'all again for having me.
Thank you.